Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. We have been discussing about neurological disorders and Panchakarma treatment. So we shall continue. Now there is a concept of modulation of the psyche of the person in the children, how we can modulate the psyche. That plays a very important role in Panchakarma also. Now it is explained that Bahya Prana and Anta Prana, there are the two entities are there. One is Anta Prana is there and another one is Bahya Prana. And Bahya Prana is Ahara. Ahara is called as Bahya Prana. And it is told that this Bahya Prana will go into continuously nourish the Antaprana. And for this Antaprana, purity of the Antaprana greatly depends upon the purity of Bahya Prana, purity of the Ahara. Therefore, now suppose a child is taking more Rajasika food. Okay, Rajasika food means excitatory neurotransmitters will be affected, so they will function more by that, or you can say sympathetic activities will go into increase. So you can assume like that, because the basic property of this Rajasika food is a pravartaka. So ultimately there will be fluctuation in the mind, because fluctuation of the mind will be there, overactivity of the excitatory neurotransmitters will be there, and sympathetic activity is more. Similarly, we have got Tamasika food. Tamasika is told as Niyamaka. So this is that set of food, okay, which is required if you are taking more Tamasika food. So inhibition activity of the brain will be more, controlling power, inhibiting will be more, and there will be reduced movement. Therefore, it controls. It can even modulation and also correction, modulation and controlling and stoppage. These are all the meaning of Niyamaka. So inhibitory neurotransmitters will be more and parasympathetic activity function will be more. So when I take more and more Tamasika food. So now coordination of between these two is very important for the smooth neurological and psychological function. Okay, we want tamas also, we want the rajas also. Now tamas and rajas should be present, they are in relative balance. Okay, if there is an increase in the tamas, then it should be corrected by increasing the rajas. This balance itself is called as sattva. Therefore, tama and raja are considered as mano doshas. Sattva is not considered as mano dosha. It is considered as mano gunas. So now sattvika food will nourishes the mind. When you take more and more sattvika food, tamasika, rajasika is over. Okay. But what is the role of the sattvika food? Sattvika food will keep these two doshas in balance. Okay. So sattvika food will going to nourish the mind. So rajasika food will going to increase the stress, anxiety, behavioral problem. The reason is very simple. It will going to stimulate the excitatory neurotransmitters. Tamasika food, and that leads to so many depressed activities or deposition of so many things, micronutrients, etc. Because tamasa is basically related to inhibition. Now balance between these two is expected to maintain the normal brain homeostasis. Now come to the next important topic, that is gut-brain axis. Now gut-brain axis is a very old concept. Previously in the primordial animals, in the rudimentary animals and all, so brain was present in the gut area. You take the reptiles and so many other things, so brain as a CNS is absent. Okay, they have got their brain in the gut area itself. Okay, but as a evolution takes place, human evolution takes place, now there is a formation of a subordinate brain in the form of the CNS. But this is in the lower animals, this is absent. And only in the humans, such a highly integrated, highly powerful, highly thinking, critically thinking brain is present. In other animals, this is absent. The reason is that gut brain is not yet transformed into the CNS based brain. The offshoot of this gut brain itself is a CNS. Okay, So even today also the brain is, major portion of the brain is present in the gut, even in the humans, although CNS is developed as a more advanced neurological system, still that brain is there in the gut. This is the theory. Okay, so now for that we can usually give the reference of this enteric nerve system. Okay, ENS, enteric nerve system. The enteric nerve system contains so many neurons, almost all equal to that of the CNS. Okay, there is Erbach's plexus, myenteric plexus. They are totally called as enteric nerve system. Most of the time they function separately. They have got minimal control of the brain inhibition over them. They control mostly independently also. Okay, so they control all the gastrointestinal system movements and secretions, etc. Okay, they are present in the wall of the gut, starting from the esophagus to anus. It is also called as second brain. Details I am not giving, you know that what do you mean by gut brain axis. Now only connection between this CNS and the gut brain, that CNS and the gut, is through the parasympathetic nerve system. Okay, lumbosacral plexus just below that, splanchnic plexus are there. So they contains this a connection between this gut brain and the main brain through the vagus nerve. Okay, so now vagus carries the parasympathetic fibers, you know that. So this is called as second, therefore this is called as second brain. It operates independently almost, and it also communicates with the brain. And if you see the logic, this is the main brain, gut brain, and CNS is the offshoot. So anything which modulate this gut brain will also get modulated the main brain. That means CNS brain. This is the logic. So now we have got a lot of opportunities to modulate this particular gut brain. If you take more sattvika ahara, then naturally the gut brain will give that same impression to the main brain, and your CNS activities will be modulated. Otherwise directly we cannot modulate the brain, isn't it? So this is one of the way out how you can modulate the CNS activity by modulating the gut brain. So how to modulate the gut brain? That is very simple, through your foot, bahya prana, through your foot. Now brain gut axis, they also have a crosstalk. We know that. So when disturbed, there may be chronic inflammation leading to cancer, depression, multiple sclerosis. Nowadays, a lot of work is going on gut-brain axis. Okay, and disease of civilization, multiple lines of the study has been shown that primary cause of this environmental associated inflammations may be the gut-brain axis, secondary to alteration of the gut microbes. Anyway, but what Ayurveda says? Ayurveda's whole theory, I think, based on this gut-brain axis, because Rogaha sarvepi mandagni, this is the first concept. Okay, so they mentioned, I think the principles of this Panchakarma itself based on this gut-brain axis, because all the major Panchakarma therapies like Vamana, Virechana, Basti, so they are given in the gut only. Vamana cleanses the upper part of the gut, Virechana cleanses the lower part of the gut, and Basti will go into again the lower part. That means these Panchakarmas are basically related to the GAT only. So they are doing the nourishing or cleansing function of this gut-brain axis. Okay, so that gut-brain will be pure, and that will give a good message, impression over the main brain, so that the function of the CNS brain will be get modulated. Okay, so if you look into the Ayurveda concepts, importance has been given to foot, importance has been given to Agni. Mandagni is considered as Moola for all the disorders. Importance is given to Koshta, Mrudu Koshta, Krura Koshta, Madhya Koshta. Koshta Shodhana is explained, Deepana Pachana is explained, Basti, Vamana, Virechana is explained. And if you look into the chakras, Mooladhara chakra, etc., the major chakras are also related to this. So in total, they have got a clear-cut idea that actually brain, more than this CNS brain, it is a gut brain which is very important. Once you are able to modulate this gut brain, then normally the CNS brain is also get modulated, and this is a way out to reach to the CNS brain. Okay, so One more important concept here comes as that is a neuroplasticity in neurological disorders. So when I say Panchakarma in neurological disorders, we should know about neuroplasticity in neurological disorders. Now what is that? That we're going to discuss in the next class. Thank you.